So what if I told you that the future of your health, we're talking the next life-saving drug, the next game-changing medical device, was basically decided in a single room over just one long weekend? Well, that's pretty much what just went down at the JP Morgan Healthcare Conference, and we're going to break down exactly what it means for all of us.
But first, to really get a sense of the scale here, let's just start with this number. $18. That was the price of a single cup of coffee at the conference hotel. Yeah, 18 bucks. It sounds completely insane, right? But it's actually the perfect symbol for the kind of money and power that gets packed into this one place, where billion-dollar deals are literally being sketched out on napkins over breakfast.
And that, right there, is the billion-dollar question, isn't it? What ideas are so powerful, so revolutionary, that they're worth talking about over an $18 coffee? Well, let's peel back the curtain and find out.
Look, the JP Morgan Conference isn't just another industry get-together. This is the Super Bowl for biotech, for pharma, for health tech. It's where the smartest people and the biggest investors all huddle up in these quiet, intense conversations that will absolutely set the course for medicine for the entire year to come. Just try to wrap your head around this. Over 10,000 of the most influential people in global healthcare. You've got CEOs, Nobel Prize-winning scientists, venture capitalists, all crammed into just a few city blocks. The amount of decision-making power in that one spot is just, well, it's staggering.
So what was the vibe on the ground? You know, after a couple of pretty tough years, the feeling was definitely what you'd call cautious optimism. And what's fueling this new energy? It really all boils down to three huge trends that are completely reshaping healthcare as we speak.
Okay, first up, trend number one, artificial intelligence. I know, you hear about AI everywhere, but this isn't science fiction anymore. We're talking about AI that can spot a tumor that a human eye might have missed, or predict a disease outbreak before it even really starts. The whole conversation has completely changed.
This slide really says it all. For years, AI was just this empty buzzword you'd slap on a PowerPoint slide to make your company seem cool and futuristic. But today, it's becoming as essential, as practical, as a stethoscope or a scalpel. It is now a core tool of the trade.
And it's already making a huge difference in three really specific ways. In drug discovery, it's chewing through data at superhuman speeds to find new potential medicines. In hospital operations, it's taking on the soul-crushing paperwork that causes so much doctor burnout. And in diagnostics, it's basically acting like a brilliant co-pilot, helping doctors spot that tiny little needle in the haystack of a complex medical scan.
And hey, don't just take my word for it. This quote from a speaker at the conference just nails it. The return on investment, the ROI, is now real. And that is so important because it means AI isn't just some cool new toy. It's a technology that is actively saving time, saving money, and, most importantly, saving lives.
All right, let's jump to the second massive trend. For the past couple of years, biotech investing has kind of been in hibernation. Well, the alarm clock just went off. The big pharmaceutical giants are sitting on mountains of cash, and they are officially on a shopping spree for the next big breakthrough.
You can see it right here. After a few years of being pretty quiet, the whole mergers and acquisitions market is just roaring back to life. We're seeing this frenzy of huge, high-stakes deals where big pharma companies are snapping up the most promising little startups, and all the signs point to this trend getting even bigger.
So where's all this money flowing? Well, a huge chunk is going to GLP-1 drugs, the revolutionary medicines that are changing everything for weight loss and diabetes. Of course, there's oncology, where the investment in smarter, more targeted cancer therapies is just relentless. A lot of money is also going to treatments for rare diseases, which used to be ignored. And finally, you've got the real cutting-edge stuff, gene and cell therapies that could potentially cure a disease with just one single dose.
And that brings us to trend number 3, which honestly might be the one that changes your life the most. For decades, the entire healthcare system was built to serve the institutions, the hospitals, the insurance companies. Well, that whole model is being flipped completely on its head. The patient is finally in the driver's seat.
And a huge reason for this is just how we pay for healthcare. Think about it like this. The old way was fee-for-service. The doctor got paid for every single test, every procedure, whether you actually got healthier or not. The new model is value-based care. Now, doctors and hospitals get paid when you actually have a good health outcome. Their success is now tied directly to your well-being. It's a total game changer. And who's forcing this big change? We are. I mean, we're all used to ordering dinner, booking a flight, or doing our banking with just a few taps on our phone. We demand convenience, we want digital access, we want to know what things cost.
Why on earth should healthcare be any different? The industry is finally being forced to play catch-up.
Okay, so AI, biotech buyouts, patient power, it all sounds pretty big and abstract. But let's bring it right down to earth. How are these three things actually going to change your next visit to the doctor?
It really comes down to this. Smarter AI means your doctor can spend less time staring at a keyboard and more time actually listening to you. All those big bets in biotech mean that more breakthrough treatments for things like cancer and diabetes are going to get to you faster than ever before. And that patient power? It means the entire system is shifting its focus to one simple goal, keeping you healthy in the first place. The bottom line is, the future of healthcare isn't just about treating sickness anymore. It's about building a system that actively promotes and protects your health.
So that's the real question that's kind of hanging in the air after this whole conference. With all this amazing technology, all this incredible investment, is it all leading us toward a system that feels less like a confusing, frustrating bureaucracy and more like a true partner in our health? A system that isn't just smarter, but maybe, just maybe, finally becomes more human? The next few years are going to be really interesting to watch.